It's been a turbulent year and a half for many in the US, but particularly for Asian Americans. One study by the Kaiser Family Foundation found the community had the highest risk of hospitalization and death after testing positive for COVID-19. And they face a continuing increase of hate crimes triggered by the pandemic. Advocates for the Asian American community say they're worried a lack of health research funded by the National Institute of Health, focusing specifically on Asian Americans, Native Hawaiians and Pacific Islanders, could be hiding the true physical and mental health impacts of these crises.
The patterns of support, specifically funding for research focused on NHPI communities, is woefully terrible. So less than a penny for every dollar that the NIH spends on health research goes to NHPI communities. And, we make up 6% of the population.
Dr. Yip is now looking into the biases faced by scientists trying to get funding for AAPI research projects.
One is this idea that Asians are a model minority. So the idea that Asians are hardworking, they're successful, that stereotype really sort of obscures the challenges that may be present for Asian communities. And another idea is that we're not doing as poorly as other groups of color.
The Charles B. Wang Community Health Center has been looking after people in Manhattan's Chinatown for 50 years. While it provides care for all, it tailors services to the specific health needs of Asian Americans. The CEO says little of the research that is done addresses the wide diversity within the community.
Asia represents like 60% of the entire Earth. So to paint Asian Americans with one brush and to collect information in that one bucket by itself is inadequate. So we are really excited about any effort that would seek to really break down the myriad health concerns and that affect Asian Americans.
Researchers say the best way to tackle a lack of health research targeting the AAPI community is to highlight the problem publicly and to engage with federal organizations that have the power to focus more resources on the issue. Sarah Walton, CGTN, New York.